Professor, thank you so much for joining us. First of all, are you happy with the Easter restriction plan, a 4-day ban on the retail sale of alcohol, and larger church gatherings, though, are being allowed?
Yeah, good evening, Sally. Look, I think there are some positives, but I'm just not quite sure of the logic of having the 2-day period before the weekend where people probably could stock up on liquor, stock up and hoard liquor. I think it probably would have been more beneficial to make it a sudden stopping of the sale of liquor. But there may have been reasons for that which we're not privy to. Other than that, of course, there have not really been any material changes to lockdown 1. That really, I think, is the only kind of change that has been put in place.
Are you concerned about that?
Not really. Look, I think ultimately it is human behavior. I think we need to kind of advertise, propagandize, send a strong message out that people need to kind of keep to all the infection prevention measures. That avoiding social gatherings, avoiding indoor environments, keeping physical distance, masks, hand sanitizing, all those things I think really ultimately are what plays a role. One can, from a governmental point of view, put restrictions in, unless it's really a hard lockdown, which of course will have a major effect, but we can't do that. But otherwise, the other restrictions are really to kind of, I guess, supplement these human behavioural changes, because that's really what counts.
Absolutely. Let's talk about vaccines now, and the news that the South African Health Products Regulatory Authority has now conditionally approved the Johnson & Johnson vaccine. Of course, before that, it was being administered under the 3B trial. What is the significance of this change? Does it mean we are good to go, essentially, for major rollout of the vaccines?
I think so. As you mentioned, it was actually implementation study rather than a trial. A trial means you have a placebo control, etc. This wasn't it. This was specifically to roll out to healthcare workers a limited amount of vaccine to a limited distribution sites. That was part of the implementation study. All these sites had to be accredited by SAPRA, and also there had to be informed consent. So it was a limited number of doses for the healthcare workers. But now that we've got emergency use authorization for the rest of the population, that really is the kind of signal for the rollout, for the general rollout, which will go now, of course, to phase 2, which are the high-risk individuals.
The news as well from the United States that the Pfizer vaccine is effective against the variant that's dominant here. Also, SAPRA telling us this evening that they expect to approve Pfizer, also probably on conditional approval quite soon. We know that Pfizer is one of the vaccines coming through COVAX. So more good news?
Very good news. Look, I say very good news. Obviously, I would like to see the data. The only data that we have had was provided by news media. And I think with all due respect, I think we do need to look at it, maybe with a more critical eye. What I learned was that I think it was 400 cases, and there were some cases in the placebo arm and nothing in the control arm. And it was a study done in South Africa with our B1351 variant. So obviously it is potentially excellent news. We had a lot of signals that Pfizer would work against the variant. From the laboratory side, from the way that it would behave with the other variants, we were pretty kind of sure that Pfizer would work very well against. But to have a confirmation at a clinical trial level, that certainly would be excellent news. It would be great reassurance. But I say I really would like to see the scientific data before passing a final verdict.
Yeah, I think that's probably a really good idea. I have to ask you about Novavax because
make that condition.
I have to ask you about Novavax because the health minister was with the Health Portfolio Committee, I understand, earlier this week, and apparently there was some discussion about why Novavax is not going to be suitable for South Africa. But it has been studied here in South Africa. Professor Shabir Mahdi, very surprised, expressing this in a Business Day article, because he said it's actually very effective against the dominant variant here. And, of course, it's been trialled here in South Africa. What are your views on Novavax?
No, I think, look, we've got a very open mind. In fact, it's first on our agenda at our next meeting. And we actually did bring up Novavax a few weeks ago. Because Novavax are also saying that they may well be making a vaccine which is adapted to our variant. But in either event, the reason why we didn't immediately go for Novavax, and I stress immediately go, we certainly have got it in our back burner, was that there's no data yet on how it would behave with severe infection. We did get reasonable data, I think 49% efficacy, which is below the WHO target of 50%, only 1% lower, but still lower than the 50% of the WHO. So there's a little bit of concern, how would it work against severe infection? Unfortunately, the trials which were done in South Africa didn't take into account severe infection. There weren't any significant number of older individuals who would be more liable to get severe infections. So it's really a question mark more than anything else. And that even holds for AstraZeneca, I might say, that if AstraZeneca does prove to be effective against the variant in preventing severe disease, and there is data to support that, then certainly that will also come back on the radar. With both of those, we just need the data. Does it prevent severe infection? That's really the kind of endpoint that we want to look at.
I understand. We know that phase 2 is due to begin mid-May. We know that the phase 2 group is, of course, the elderly, those with vulnerable health comorbidities and essential workers. And I understand that you've decided to prioritize the elderly first. Could you explain the reasoning for that?
Yeah, if you look at the morbidity, and it's not only South Africa, morbidity and mortality, that was severe infection throughout the world, every country after country, and including South Africa, the biggest risk is being old. That's the biggest risk. Then second biggest risk are the various comorbidities, and there's also kind of stratified them. That some are more, some have a higher score. We're actually given a scoring to the age and the comorbidities. And certainly age comes out way on top. And this is from a lot of data, international data throughout the world, many studies. That's why the priority is given to the aged. And you can ask anybody that works in an intensive care unit that what they see, the kind of major group of individuals who are severely infected are the elderly. That's the main risk of severe disease.
President Ramaphosa has told us that we're going to eventually have 2,000 vaccination sites across the country. Aspen has told us that they can certainly produce enough vaccines to accommodate 250,000 vaccinations a day. This is obviously at the peak of our rollout. First of all, do you think that is possible to be able to administer that many vaccines a day? And when do you anticipate we'll be doing that many?
Sally, all I can say is that, like you, I've got the same reassurance that we've been given from the Department of Health, from the President, from the Minister, that it is feasible. So we either believe that or we don't. I think it probably is feasible. Whether they will exactly meet that target, well, look, the original goal was, in fact, to immunize the majority of adults by December. Now that's moved a bit later, a couple of months later, which is not that serious. For that group, they're going to be protected against mild, maybe moderate disease. But, I think one sets these goals, one hope one reach it. I don't have any more information than you or anybody else. And it's really the reassurance that's come from the Department of Health. Fortunately, as a MAC, as a Ministerial Advisory Committee, we're not really involved in the administration of the rollout. We just get the information from them, and the information seems pretty confident.
Well, absolutely. Let's hope it is all hands on deck. Private sector, public sector working to reach that 250,000 jabs a day. Really doing well, we hope, soon. Thank you very much for chatting to us this evening. Professor Barry Shub, virologist and chair of the Ministerial Advisory Committee on COVID-19 vaccines.